Kenyans have 12 days to register for the Social Health Authority, otherwise known as SHA, or risk missing out on health insurance cover. Now, under the scheme, all Kenyans, both contributors and dependents, are required to enroll to enjoy the health cover. As Emily Chebet reports, the Ministry of Health says it has notified employers to remit October NHIF deductions to the new scheme.
The clock is ticking for Kenyans and users of the National Health Insurance Fund services as the government remains determined to roll out the new medical insurance scheme under the Social Health Authority by the 1st of October despite existing legal challenges. Medical Services Principal Secretary Harry Kimtai says the last reimbursement under the NHIF will lapse on the night of 30th September 2024.
Anybody who goes to hospital, treated, discharged, inpatient or outpatient, effective 1st of October, will be treated under the Social Health Authority benefits.
According to the ministry, Kenyans must be registered by end of this month as a member of the Social Health Insurance Scheme. Individuals can register by themselves or at different health facilities across the country.
We've also made a provision that if you reach the hospital in case of emergency or you have not registered by that time, which we are not encouraging, there will be an agent who will have been appointed by Social Health Authority to take care of registration.
The ministry says that from next month, employers will be required to remit what has been NHIF deductions from employees to the new scheme under the Social Health Authority.
We have notified the employers on the process of how to register using the employer portal so that they are able to remit the employee's salary for the month of October to go not to NHIF but to Social Health Authority.
Earlier this week, the ministry reported that 1.2 million Kenyans had registered with the Social Health Authority. The ministry is confident that in less than 2 weeks to the new month, there is sufficient time to put everything in order to ensure a smooth transition.
At mashinani level, where there's the infrastructure, probably even people may not be able to get to the nearest health facility in good time. Therefore, it is important to utilize the community health promoters at the bottom of the pyramid.
This one needs a drive, the way we normally have campaigns. You normally have campaigns whenever you have a situation. We need to be deliberate out there and say we are going to have the ministry having a drive to register.
It is not just the beginning. It has been tried and tested in Kenya since 2003. The concept has been there. And so who else to implement? This is our time to implement.
The new medical scheme will see every salaried Kenyan pay 2.75% of their income to the fund. Kenyans who are not in formal employment will fill out a questionnaire to determine their annual income. They will then pay 2.75% of this income, but not less than 300 Kenya shillings every month. Emily Chebet, Citizen TV.